Hi friends, in today's pandemic, there are a lot of cases after post treatment of corona. That's called post-COVID fear psychosis, post-COVID fear, or in general, there's a lot of fear in the public. So, to this, we have to understand first of all what is the meaning of fear and how does fear affect our body, so that you can differentiate between symptoms what are there of normal fear and actually the symptoms of fear. You have to understand how does the fear originate and how does the fear affect different systems of the body, maybe the cardiovascular system, the respiratory system, the excretory system, so that you can differentiate between a pathological and a functional symptoms in the body. To start with, let us understand first of all what is fear. So as soon as a person recognizes a fear, there is an organ called amygdala. It is a small organ in the middle of the brain that goes to work. It alerts our nervous system, which sets our body's fear response into motion, and the stress hormones are released, namely cortisol and adrenaline. Now, this is basically, first of all, understand, is fear something very unusual? It is no. Everybody gets scared. Everybody gets scared, and fear is an unavoidable facet of a human experience. Uh, People generally consider fear as an unpleasant emotion, but some go out of their way to trigger it. For example, we see people jumping from great heights, monkey jumping, or seeing horror movies, so to get that trigger of fear. What happens when there's fear is very important to understand, and the first thing is the breathing rate increases. The person starts breathing heavily, the heart rate increases, there is peripheral vessel, the blood vessels of the skin basically contract, and what happens, the skin also contracts, so there is horripilation is called as goosebumps skin, it is called as. And when a human hair stands on the end, it does not make much difference to the appearance, but for hirsute animals, it makes them seem larger and more formidable. Metabolically, the level of glucose rises, the glucose gets a spike, providing a ready energy. Means when there's fear, because of the spike of glucose, we are ready, the stores of energy increases, and we are ready to fight, and we are ready in action, it is called as. In the same way, the level of calcium, white blood cells in the bloodstream also increases, and because of that, the fight or the flight response begins in the amygdala. An amygdala is basically an almond-shaped bundle of neurons that forms a part of the limbic system, and it plays a very important role in processing our emotions, including fear. For example, we'll see the action of fear on the cardiovascular system. Anxiety disorders can cause rapid heart rate, palpitations, and chest pain. You can also have an increased or high blood pressure and heart disease because of anxiety, because of fear. If you already have heart disease, the anxiety disorders may risk into a coronary event. So, a simple fear can lead it to a disease also. The excretory and the digestive system also has been affected by fear and anxiety. What does anxiety? Anxiety affects these excretory and the digestive system. You may have stomach aches, you may have nausea, you may have diarrhea and other digestive problems और इश्यूज. यू हैव लॉस ऑफ एपेटाइट. वी सी नो, जब भी घबराहट होती है, डर लगता है, तो हमारी वी हैव लॉस ऑफ एपेटाइट, वी हैव बटरफ्लाइज इन द स्टमक. ऑल दीज सिम्टम्स आर ऑफ फियर ऑफ एंजाइटी. So there's a connection between the anxiety disorders and the development of irritable bowel syndrome after a bowel infection. And irritable bowel syndrome can cause vomiting, it can cause diarrhea, it can cause constipation. In a nutshell, it affects the stomach and the digestive tract, causing indigestion, bloating, gastric problems, and a lot of problems of the GIT. In the same way, the respiratory tract is affected. What happens during anxiety? Anxiety causes rapid and shallow breathing. And if you are a chronic obstructive pulmonary disease patient, COPD, you may get you may be at an increased risk of hospitalization from anxiety related complications. Anxiety can also make asthma symptom worse. So if you're asthmatic, your anxiety can make your asthma symptom worse. You can have COPD patients who have problems of breathlessness, which are worse because of anxiety, because of fears. Because there is a biochemical reaction. For fear is a natural emotion, no, and a survival mechanism. Fear is basically survival. You have fear, that's why you are healthy. You live life. If it goes out of control, then it is called disease state. The physical response to fear is known as the fight or the flight response, which the body prepares itself to either combat or run away. And this is very important. And how does a fear work? That is important. Fear prepares us to the react to danger. And how it slows or shuts down the function and needs for survival. It sharpens the function that might help us to survive, such as the eyesight. Our heart rate increases. The blood flows to the muscle so we can run faster. Imagine a tiger, you went for a safari and the tiger is in front of you, and now you have to run for survival. And must have observed that we can run more, better, and faster than we actually are. That's because of the fear and the physiological response to fear. Our body also increases the flow of hormones to an area of the brain known as the amygdala to help us focus on presenting danger and store in our memory. Of course, there are a lot of impacts of fear in our body. For example, each person may experience fear differently. It is not that everybody will have the same experience of fear, but some of the common symptoms of fear maybe are chest pain, chills, dryness of mouth, nausea, rapid heartbeat, shortness of breath, sweating, trembling. So these are basically common symptoms or expression of fear. So every time fear is not a disease, and every time fear is not health. In this post-COVID situation, you may have observed a lot of this symptom and went to the doctor for treating fear. But understand the body's physiological need of fear and the symptom which has to be cured. In homeopathy, we have a very, very interesting and a very, very important remedies to combat this fear and get the patient rid of the post-COVID fear or the fear complications or the fear psychosis, as we say, because that can give rise to a lot of other disease, as we have already mentioned. So if you have any of these symptoms of fear, or you're fearing that you will get COVID, or this post-COVID fear psychosis, do visit a homeopathic doctor, and he will be able to guide you and help you in treating your fear and making you calmer so that your body is in a healthy state. Healthy mind is a healthy body, my dear friends. So don't fear the fear, treat fear by a good homeopathic physician. Thank you.